I'm Alan Banks with GuidedSMILE, and today we're going to talk with T-Bone from 3D Dentists about his unbelievable courses for full arch. And the reason that I'm talking to you about it is because our product GuidedSMILE is what's used in his live patient surgeries. And you have a huge course where doctors fly in, and there's two options. What are those two options?
Yeah, so actually, Alan, we do three different types of training, okay? So when it comes to full arch, number one, we do, if you want didactic training where you just want to learn on models and lecture how to use a digital workflow featuring stackable guides that get predictable outcomes for your patients, we have a 3-day didactic program. And in addition to that, the second option is if you want to do live patients where you do surgery on our patients, where we provide you the patients and everything. If you want to do surgery, that's an additional 2 days.
Gotcha.
So that's called our Full Arch Express Week.
Okay.
So you can stay for 5 days, you get the didactic program, you get the live patient opportunities, you get all of it all at one time, and it's fantastic.
And in that course, when you're performing a live surgery, you have two options. One is the full stackable GuidedSMILE protocol we've been doing for years. And then you and your team also teach the Combi Guide, which is bone reduction, implant placement, and then more of a digital workflow.
Our goal is to get people digital, right?
Yeah.
So we want to do stackable guides. We want to, for offices that are just getting started and they're like, hey, I don't want to go all in, but I want to do a stackable guide for the comfort and the predictability. We totally get that. That's how I am. We do the traditional pickup method. And for those that say, hey, you know what, I'm into this printing thing. I want to print. I want to have all of this stuff. We have the digital workflow for them as well. Okay. So, and they get 2 patient opportunities. So they'll do 2 full arch cases in their 5 days with us.
Oh wow, 2 patients.
2 patients.
They do it as a team?
So they get their own arch. Each person gets 2 arches. Okay. So they'll do 1 arch each. So 1 arch each day, and it's fantastic. But you do pair up and work great.
That is fantastic. So we go to all these courses. It's a great experience. I mean, have you ever had a negative feedback at it? Probably not.
There's always people you can't make happy. But yes, generally speaking, we get positive feedback because honestly, there's not really a lot of places in the United States where you can do live patient training on full arch patients. And it's not restricted to XYZ state or just that state. If you're a licensed dentist in good standing in all of the 50 states, you're welcome to North Carolina and do all of that.
Is it an application process? Or
there's basically you call, you register. We'll ask you a few questions to make sure you're somewhat qualified to be doing this type of dentistry. If you never place an implant, you're like, I want to go in full arch, we're probably going to say no. I hope we're going to say no. Right. And then the third course that we have, which I'm really proud of, which is new from last year, is our Business of Full Arch program. And that's really designed for the dentist that's, hey, look, I'm doing full arch, I'm doing some here and there, and I'm really ready to make it a part of my business. But before I start spending money on marketing, before you do all that, I believe you got to understand the business of full arch. What does it take to market well? How do you differentiate yourself? How do I set up my team to handle the influx of inbound calls? How do we do the consultations? How do we set up the financial arrangements? How do we have a good follow-up process with these patients? It's a totally different ball game selling full arch dentistry versus selling general dentistry. It's a different ball game. And so we teach that, and we teach your team members, we role play, and then we also teach, because once you get to the point where you're doing 4, 5, 6, 7, 10 arches a month, now you got to really integrate your clinical program and make sure that you're digital, that you're doing some more work in-house, that you're scheduling properly, you're trying to stack cases, you're trying to stack impressions. And so we kind of really work through in 2.5 days what's really been successful in my office, what's been successful in my partner Sully's office, so that we can help teach you exactly what's made us successful, made us profitable, made us predictable. And we just kind of peel back the curtain and let you see everything that's going on.
Wow, and that's a team coming in.
Yeah, that's the whole team coming in. Wow. Your surgical implant team, the financial team, the dentist, all together. We have breakout sessions. The front office team is working on the finances. The assistants are working on the clinical part. The dentists are working on the surgical part. It's really it's a pretty damn good program.
How do you sign up?
Yeah, you just visit 3d-dentist.com. You find me on social media at T-Bone Speaks, or you can call the guys here at GuidedSMILE, and they'll be happy to help you out. They'll send you to us.
Yeah, love it. All right. Yeah,
great
stuff.
Thank you, Alan.
Yeah.